Welcome to the Hatching for Health show. I'm your host, Jessica Hatch. Today we have a family on. We have Pari as well as her son Donovan, and he has Ehlers Danlos Syndrome. We're going to talk in great detail about what exactly that condition is and see if there's ways that we can help. We'll have Dr. Eisenberg, who's a rheumatologist, who will also come onto the show, as well as Jennifer Mijas, who's a registered dietitian. So we look forward to meeting everyone and getting started. Hi, welcome to the Hatching for Health show. I'm your host, Jessica Hatch. Today we have Pari and her son Donovan on the show to talk about the Ehlers Danlos Syndrome. This is a condition that Donovan has, and it's a condition that he was born with, and we want to talk more about in depth to learn the details of it so that we can help others. The Ehlers Danlos Syndrome is a group of genetic connective tissue disorders. It affects not only the blood vessels, the skin, as well as the joints. So currently there is no cures for Ehlers-Danlos disease, and it is known as something that they live with for a lifetime. So it's being able to figure out how to live with it and to just better their lifelong journey. So we're going to talk to them now. Thank you guys for being here on the show.
Thank you for having us again.
Definitely. So I wanted to just start by knowing, when was it that you learned he had this condition?
Donovan was diagnosed at 4, but we had been seeing symptoms since birth. We just didn't know what they were.
Okay, really? So at 4 years old, it was just things going on with his skin, his body, that you felt that there was something that should be looked into?
He actually started experiencing something called intussusception, which is whenever the intestine telescopes, and it's because of Ehlers-Danlos that the connective tissue is faulty. It produces faulty collagen. And so we were trying to figure out why he kept getting the intussusception, and we were doing a routine endoscopy, and they actually found a disease process called eosinophilic esophagitis. It's a mouthful.
Oh, man. Yeah.
And we knew that was a rare disease and had been recognized in about the last 20 years. Mm-hmm. There's medical facilities popping up, clinics around the nation for eosinophilic disease. So there's a little bit known about it.
Okay.
And during that research, I had seen that there was a connection with connective tissue disease. And I was pretty sure that Donovan had Ehlers Danlos. There's multiple forms of Ehlers Danlos. They range in severity. Mm-hmm. It is a spectrum disorder. It's multi-system involvement, and you have essentially every organ system is involved because you have so much connective tissue in your body. The gastrointestinal system.
Yeah, so that's what I was going to ask. I mean, what does that look like, being that it affects so much of the human body? Like, what type of doctors is he having, to go in and see on a regular basis?
That's a loaded question, because we see a doctor in just about every field. Who primarily runs our care is allergist immunologists and rheumatologists. They both deal with the immune system. And then also cardiologists and neurologists that deal with the autonomic nervous system.
Okay, so are you learning all of these types of doctors' names and the different specialists that they are?
Yes, I still am.
Are you? Yeah, that's quite a few. You probably have a whole team.
A whole team.
Yeah. They seem like they're taking good care of you, though, so that's good. I think you've grown like 3 inches since I met you. Yeah.
I appreciate you doing this, because rare disease needs advocacy, and until people start talking about it, there's not going to be any any cures. And there's over 7,000 rare diseases to date, and 95% of rare diseases do not have a single FDA-approved drug or foundation in their name. And those are staggering numbers. 30% of children with rare disease don't live to see their 5th birthday. And we learn so much from regular common diseases with rare disease. For example, rheumatology follows our care a lot because there's a lot of immune dysfunction with Ehlers Danlos. And we learn about things like lupus and different kinds of particularly autoimmune diseases. We learn so much with rare disease.
So tell me, day to day, how it affects. And maybe you can, answer a little bit of this, Donovan, how it affects you from when you wake up in the morning. Of course, do you have brothers and sisters?
I have one sister and no brothers.
Okay. And is she older than you, or?
No, she's younger.
Okay, how old is she?
5.
And you said you're 8?
Yes, but I'm
Okay.
4 years older than her. She was born in 2014.
Okay. So is there things that you notice like different about her than you?
Well, I noticed her words, like she can't pronounce R's right.
Okay, so that's because she's younger than you, right? Okay.
A little bit of a speech delay with the youngest one.
Okay.
I mean, you know, these diseases are within the family, and so it didn't take long. Ariana, my daughter, was actually 3 months old whenever Donovan was diagnosed, so it didn't take long to start seeing the symptoms and what was not normal.
Okay.
And actually, since Donovan getting diagnosed, I've actually been diagnosed with systemic mastocytosis and a form of autonomic dysfunction called POTS. And he's helped get me those.
Really?
So, yeah, and
So a lot of
you're
it
learning,
is-
learning about the family.
So, you know, I know that you obviously are in school and you have, you know, kids around you at the same age. Are there things that, you know, you realize that you're different, that you see, you know, maybe it's playing sports?
Yes, a big thing with sports.
Really? Because you know, you're a lot more sensitive, your bones, and is that right?
Yeah, he dislocates quite a bit. During the newborn screening, his hip is dislocated. His jaw dislocates quite a bit. His hands.
My hand.
Yeah, so his hips are pretty greatly affected. He uses a wheelchair whenever he's at school and for long distances.
Okay.
He goes on periodic homebound from school. Unfortunately, with the connective tissue,
Yeah.
you've got these cells that help make this connective tissue, and they are also allergy cells. And so there's a lot of allergy within this
Okay.
little system here. So tons of food restrictions, that creates a lot on quality of life.
Yeah.
There's so much centered around food. We eat when we're happy, mad, sad, holidays. Unfortunately, for a child that can't eat, that's isolation. And sorry, we're gonna have to backtrack on that one.
Yeah, no, you're fine. So a lot of the family, the things that you would do as a typical family for holidays, or, you know, whether it's Christmas or
Altered,
Thanksgiving, I mean,
definitely.
the things that, you know, he can eat are going to be different. So when you're going to, you know, friends and families to celebrate, you know, those special times, like, you have to always be cautious of what he's, you
Correct.
know.
Even going out to eat, we don't
Yeah.
go out to eat, you know, because one, you can't tolerate the food. Then what does your child do?
Yeah.
Unfortunately, children with eosinophilic esophagitis, oftentimes they have to rely solely on an amino-based formula. It's a medical food, but because of that word formula, it's often not covered by insurance, and this is a national issue. And it's something that advocacy groups are working very hard to try to fix, because if it's sole nutrition, our children should be able to get it.
Yeah.
And it's
Definitely, and be
it's
covered.
not, and it's $55 a can, and
And insurance just doesn't want to help.
yeah,
Really?
Unfortunately, he sees that.
Yeah, and that's something that he's
is.
ingesting on a daily basis. It's a need.
Donovan's lucky. We've gained some foods.
Okay.
We have gained foods, but many of the children, they rely solely on this formula, and like I said, it takes a lot to be able to afford that, especially when it's sole nutrition. Just supplementing, it was about $1,300 a month for him, and
Goodness.
we're trying to, you know, make legislation federally to get this changed.
That's amazing. Like, I applaud you and what you're doing. I mean, obviously it's directly associated with your own family, your son,
Yes.
but I think I see you more, you know, out there on social media, just kind of trying to help highlight it to the community. So
It is a family disease. It takes a village, and they are not lying whenever they say it takes a village.
Yeah. I do have 2 special guests that I want to bring on that, you know, are able to talk specific to, you know, what's going on. One's a rheumatologist, and the other is a dietitian. So I'm going to go ahead and bring on Dr. Eisenberg, and she is going to visit with us, and we're going to ask her some questions about patients that she has seen with this particular condition and see how it can be of help. Welcome back to Hatching for Health. We now have Dr. Michelle Eisenberg on the show, who is going to visit with us and talk to us a little bit about her experience with this syndrome. Thank you for being here.
Oh, you're welcome. Thank you for having me.
Definitely. And you guys have all met. We've got
Yes,
Pari and
ma'am.
Donovan.
Yeah.
Great, great. So I know that you personally, treat this and you see patients that have this syndrome. So I thought, what a perfect fit. I know you and personally, and so I'm really appreciative, first of all, for you just being willing to come and talk to them. So tell us a little bit about your experience with the disease and, and the treatment that you provide.
Sure. So I'm an adult rheumatologist mainly, and I practice in Southeast Houston. As a rheumatologist, we treat musculoskeletal diseases, which comes in many, many forms, and Ehlers Danlos is one of those forms. Although, as you know, this syndrome is very rare. It's about less than 200,000 cases a year in the U.S. So it also has a 50% genetic pass-down rate as well. So I don't see that many of these folks, but when I do, it's usually because people have been complaining of joint pain, just vague joint pain, neck pain. They'll come in after prolonged physical activity with subluxations. They'll dislocate their knee multiple times. They'll come in throughout their childhood years and they'll show their parents and their friends tricks, how they're hyperextensible, right? They can do splits, no problem. They'll take their hands, their fingers, and they'll touch the wrist, something that most people cannot do. It's all because of the collagen disorder.
So are they coming in knowing that this is their diagnosis, or are they coming in even as adults, at that age and not knowing exactly what's going on?
Usually they don't know. What they do typically is they do a Google search.
Okay.
And they put their symptoms in. They say, I think I have this rare disorder. I'm not sure. Can you test me for it? And usually 9 times out of 10, there will be somebody in the family with some history of some collagen disorder that either wasn't diagnosed or actually had been genetically detected at some point. So patients these days are very knowledgeable given the internet. And so most of them know that there's something very wrong.
Yeah, so what would you say? I mean, they've obviously known for, 4 years now, because when he was 4, he's 8. And so they've gone through, learning which doctors to go to and what's going to help with what. I guess kind of what advice could you give them at this stage, of his condition and knowing that that's part of his life?
Well, because he's only 8 years old, factors such as work style modifications are not applicable to him. It's more of school, it's recess. What they can do to help him so he doesn't accidentally injure himself. At kids this age, I have 2 boys myself and they like to play sports. And so that may not be an option at this point. There's also things they can do in the school as far as sitting, writing, just modifications that can help him so he doesn't injure himself. It's tough for an 8-year-old to have to deal with some of these restrictions. Absolutely.
So there was something I read about when it's specific to the blood vessels with this condition that it's more extreme. Is that the case? Have you had patients that it was specifically affecting their blood vessels more than the other tissue areas?
Collagen is a part of skin. It's around joints. It affects tendons and ligaments. The vascular part of EDS is very rare. And those are patients that present with strokes early. They have aneurysms and whatnot. So that's something more rare, and that's very serious.
It's another form of Ehlers Danlos.
Yes.
There's 13 different forms of Ehlers Danlos.
Because that when I was,
That's much more rare.
Calm down.
Yes.
11 of them.
No. You just said one. Lots of diagnoses, but just one Ehlers Danlos.
So, with listening to Dr. Eisenberg about the sports and stuff, I was curious, what is it that you want to be as you grow up? What are you passionate about?
I
Say what you want to be when you grow up.
want to be a SWAT member when I grow up.
Okay. Awesome. That's an aggressive, whatever way you want to look at it.
Yeah, I'm like, we're still, we don't do PE and we use a wheelchair at school and for long distances, but we will get there. We'll figure out what we can do for the SWAT team.
I'm sure with certain accommodations.
That's right. That's right.
So this is kind of a question I have for you guys. You as a doctor seeing this, not very common, but consistent enough to have experience with it, and then just the research you done on behalf of Donovan, do you feel kind of from the outside, like the NIH, or I know you mentioned another organization that is really focusing on these rare diseases, that there will be, some sort of cure to where this, is eliminated from being a condition that he has altogether?
I hope so. With awareness, I think that the possibility is greater.
And
Absolutely.
Yeah.
With advocacy, such as your show and other avenues, the more awareness, the more, this disease hopefully in the future.
Yeah, that's great to hear, because
Things will come to
that's what it's
fruition.
about. It's, about the many people coming together and highlighting something so that it can, be more apparent to the general public.
Yeah.
There's probably other children out there that, have no idea, and they're going through these different symptoms, and, just seeing this will kind of help them, with the right medical care as well.
Thank you for doing this.
Definitely. I do also have Jennifer Mihas, who is going to come on and talk a little bit as it relates to his intake of food and supplements, as she is a registered dietitian. So let's take a quick break and we'll come back with Jennifer.
Thank you, Jessica.
Thank you so much. Welcome back to the Hatching for Health show. We have our dietitian here, and what is her name?
Mejias.
Yes, it's Jennifer Mejias. Thank you, Donovan, with your pronunciation. Much better than mine. So we are very thankful to have her here as well. As I mentioned, she is a registered dietitian, and as we've spoken about on the show, there are several items that Donovan cannot eat, should not eat, and will affect his everyday life. So we wanted to have her speak directly to them and kind of give some pointers and maybe have some questions answered. So thank you for being here.
Thank you so much for asking.
Yeah, definitely. So tell us a little bit just about your specialty and how you feel you can help.
So registered dietitians actually help with certain, it could be anything from autoimmune disorders to just overall prevention. But when it comes to a level of this kind of, it's many conditions because they go hand in hand with one another, it's important that we keep them nourished. We want to avoid malabsorption, especially when you are sensitive to certain foods. So it's incredibly important that we focus on the children to adults receiving the appropriate amount of calories, protein, fat, carbohydrates, as well as your micronutrients like vitamins and minerals.
So for them specifically with Ehlers Danlos Syndrome, I know that you probably have spoken a little bit about what he currently is eating, and maybe talk to us, Pari, about specifically what he eats on a regular basis.
So Donovan's limited on his food. He is, obviously due to several conditions here. We avoid foods that are really high in histamine, dairies, dyes, preservatives, none of the junk. Everything's made.
Okay.
We have to make it all.
So in fact, it's somewhat a much cleaner diet, not ideal for children, but it is.
We do find supplements. I try to say think supplementation, not elimination, because you can make a pancake out of a banana. So there's a lot that you can do with food. Look up there.
Yes, I'm sure there is. And Jen, just kind of knowing that, like, there's some suggestions that you might have for them as a family.
Well, she nailed it. She's on top of it. Great mother at this. She is saying exactly what is important in the dietetic field. Is it's not about taking away food, but rather making sure that we're adding in the right foods. So you are incorporating a variety of things. Again, we want to make sure that we're not dealing with malabsorption or malnourishment altogether. So it's difficult if you're sensitive. You might be lacking in certain nutrients, or maybe he's low in calories, which is difficult to grow as a child. So the fact that we're playing with foods in a good way and we're testing out things is a brilliant thing, because a lot of people that struggle with this disorder, amongst all of the cluster of them, are forced to be on formula or tube feeding, and that in itself is just as expensive, and supplements are expensive. So
even with the diet, we do IV vitamins and supplement tons. He's deficient in quite a few vitamins. They just don't absorb at a cellular level, and we have to stay on top of the vitamins.
Okay, it seems more common. There's a lot of places out there where you go and do IVs that are kind of providing a combination of vitamins.
We actually are able to get everything at home.
So, good.
Yeah. He gets fluids, IV vitamins, any meds he needs.
Yeah. So what would you say is your favorite food that you can eat and that you can't eat? Start with what's the food that you want to eat that you just shouldn't because it affects your body in the wrong way?
I forget what they're called. Like
Baby bottle pop.
yeah.
You like those? You
Yeah.
can't have
The blue
Yeah.
color is very enticing.
the blue one.
Baby bottle pop. I don't think I've
You
heard of
don't.
that. No.
Yeah, and do you dip it in
Powdered
that sugar?
sugar.
Oh, okay. Okay. Yeah, that doesn't sound good at all. I mean, it sounds good, but it doesn't sound healthy at all. And then what is it that you enjoy eating, even though it's kind of honed in, it's restricted to your diet? What do you enjoy?
More pizza.
Pizza?
Yeah,
Like an 8-year-old.
try to tell them something that we don't do like on occasion. Like something in your everyday diet. What's your favorite food?
Yeah, something that you.
Oh, say baby bottle pop, even though I only have one.
I think you're wanting one right now.
Come on, just answer your favorite food. Look at the camera. Just answer your favorite food. What's your favorite food?
Pizza.
Pizza.
Is it pizza? Okay.
Guess what my favorite food is? Pizza.
Yeah. So is that something that you alter? Do you use a certain kind of cheese?
Yeah, so we do dairy-free, gluten-free.
Okay.
And then when we couldn't do tomato, I did even a spaghetti squash base. I mean, a butternut
great.
squash
And it
base
still
for the tomato.
tasted good.
Good.
It did taste
Yeah.
good, you're right.
That's wonderful.
I'm glad that you're not
Very
picky.
good.
That would have made everything worse.
It's a challenge.
Well, I did want to also ask you, who's somebody that you admire and look up to?
I would have to say my grandpa, her dad,
Oh, that's so sweet.
Aw, wonderful. Why do you look up to him?
because he's very positive.
That's awesome. How sweet.
He's gonna cry when he
Good,
hears that
good
one.
for you. Good for you.
And I think it's important to be positive. Right?
Yeah.
That's
right.
great that you have that support.
Yeah, you have
A lot to be thankful for.
and a very great attitude. And thank you for coming today. I really appreciate it.
You're welcome.
Yeah. Well, thank you all. I'm very thankful for everyone that was willing to be a part of today's show and for willing to share your story and be vulnerable to that. I think it's going to help a lot of people. And thank you, Jennifer, for your input
Thank you for having
from a
me.
dietetic standpoint. And that's a wrap. Thank you guys for being here.
Thank you so much.
Thank you. That concludes Hatching for Health, episode 1. Thank you so much for tuning in to the first episode of Hatching for Health. We hope that we were able to educate you a little bit on Ehlers Danlos Syndrome. Next week, we're going to have a child on the show that has cystic fibrosis. We'll also have Dr. Alex Lachine, who is a pulmonologist, talk to the family and so that we can learn a little bit more about that disease. So thank you so much, and we will see you next week.